If you are enrolled in the Canadian Dental Care Plan, the federal dental program for seniors, your coverage is about to expire. And if you do not renew it before June 1st, you will lose your dental benefits on June 30th. Not reduced, gone. And here is the part that really matters. Any dental work you have done during the gap in coverage comes completely out of your own pocket. No reimbursement, not retroactively, not partially, nothing. The government has been very clear about this, and the deadline is a hard stop with no exceptions. Today, I am going to walk you through exactly how to renew, what to watch out for, and a hidden trap involving your tax slips that could get your renewal rejected, even if you follow every other step correctly. Stay with me. That slip issue affects far more seniors than you might expect, and I will explain it fully before this video is done. Welcome. My name is Naim, and this is Canadian Retirement Benefits, your daily source for everything that matters to Canadian pensioners. Today, we are focused entirely on the Canadian Dental Care Plan renewal for the 2026 to 2027 benefit year. This program has now covered over 6 million Canadians, saving participants an average of $900 a year in dental costs. If you are one of those people, protecting your coverage is urgent, and the window to do it is closing fast. We are going to cover the exact deadline, the step-by-step renewal process, the income rules that determine how much you pay, the new dental services update from April 2026, and the one thing you must check on your tax slip before you submit your renewal. Let us get into it. Let us start with the timeline, because this is the foundation of everything. The renewal window for the 2026 to 2027 benefit year opened on April 15th. The hard deadline to renew is June 1st, 2026. If your renewal is submitted and processed by that date, your coverage flows seamlessly into the new benefit year starting July 1st. You will not even notice a gap. Everything continues as before. If you miss June 1st, even by one day, your coverage does not immediately disappear. There is a short grace period, and the old coverage technically runs until June 30th. But here is the problem. Once you miss the June 1st deadline, you are no longer in the renewal process. You are now in the new application queue, which opens June the 2nd. And new applications take 4 to 6 weeks to process. That means a senior who misses June 1st by even a few days could find themselves without dental coverage from July 1st through mid to late July while their application is being reviewed. Any dental work during that gap, routine cleaning, an emergency filling, anything, is entirely out of pocket. There is no retroactive reimbursement under any circumstances. The program's rules on this point are absolute. This is not a government program known for flexibility on missed deadlines. The June 1st date was set many months in advance, and the government has communicated it clearly. If you have not already renewed, please make that your priority as soon as this video is done. Now let us talk about how you actually renew, because there are a few different ways, and I want to make sure you know about all of them, especially if you are not comfortable doing things online. The primary way to renew is through your My Service Canada account online. If you have one, log in and look for the Canadian Dental Care Plan section at the top of your dashboard. It should be prominently displayed right now during the renewal period. You will click on the link that says Renew Your Canadian Dental Care Plan coverage, and then move through a series of screens. Each screen asks you to confirm specific information, your name and address, confirmation that you have filed your 2025 taxes, and this is the most important screen, confirmation that you do not have access to private dental insurance through an employer or pension plan. On that last screen, be careful. The question is not simply whether you have dental insurance right now. The government asks whether you have access to dental coverage, meaning whether coverage was available to you, even if you chose not to take it. Even if you opted out of a plan at work years ago, this is a legal declaration, and providing incorrect information, even accidentally, can result in removal from the program and a requirement to repay all benefits you received. I will come back to this in more detail in a moment because there is a specific tax slip issue connected to this that catches many people off guard. After confirming all the information, you will reach a submission screen that generates a confirmation number. Write this down or take a photo of it. It is your only immediate proof that you completed the renewal before the government's formal determination letter arrives in the mail. If you are not comfortable doing this online, there is a phone option. You can call 1-833-537-4342 and complete your renewal through an automated phone system. You will need your social insurance number and your CDCP client number. That is the unique number printed on the top right corner of the renewal invitation letter you should have received in the mail. If you cannot find that letter, call the same number and a Service Canada agent can help you locate it. You can also visit a Service Canada location in person if you need face-to-face help. And if you have a family member or trusted person who handles your affairs, they can assist you. But if doing so by phone, you must be present on the call to give verbal consent. By the way, if you are finding this video helpful and you are not already subscribed to Canadian retirement benefits, now is a great time to tap that subscribe button. We cover topics exactly like this one every single day: deadlines, benefit changes, and practical guidance that most seniors never hear about until it is too late. We would love to have you as part of our community. Now let me explain the tax slip issue I mentioned at the beginning, the one that can derail your renewal even when you follow every other step correctly. When you file your taxes, your employer or pension administrator is required to include a special code on your tax slip. On a T4A, and which is what most pensioners receive, that code appears in box 015. On a T4 from an employer, it is in box 45. This code tells the government whether you have or had access to dental insurance. The codes run from 1 to 5. Code 1 means you have no access to dental coverage. You are eligible for the CDCP. Codes 2 through 5 all mean some form of dental access exists, and any of those codes can trigger an automatic denial or eligibility review when you try to renew. Here is where it gets complicated. Some pension administrators and employers are still making errors in how they report these codes. A retired person who genuinely has no dental coverage may have their slip coded incorrectly as code 2, usually because the administrator is not fully up to date with the new reporting requirements. When that senior goes to renew their CDCP, the system flags the discrepancy and the renewal gets rejected or delayed. If this happens to you, the fix involves contacting your pension administrator or former employer and asking them to issue a corrected slip or a written letter confirming the error. There is also a specific government form for this situation, the Member Eligibility Review Form, which your pension administrator completes to explain the discrepancy. These documents need to be mailed to the Oral Health Branch of Health Canada. This takes time, which is why I am telling you about it now, before June 1st, so you have time to resolve it if needed. Before you renew, please take a moment to look at your 2025 tax slip. Find box 015 on your T4A or box 45 on your T4. If it shows anything other than code 1, contact whoever issued that slip immediately and get the process started to correct it. Do not wait until after June 1st. By then, it will be too late to resolve in time for seamless coverage. Let me tell you about a couple we will call Ruth and Gerald. They are both 71, living in a suburb of Winnipeg. Ruth has no dental insurance. She retired from a job that had no benefits. Gerald retired from a unionized job and through his pension plan had access to a basic dental plan, but chose to opt out of it years ago because the premiums were high and he rarely went to the dentist. When the CDCP launched, both Ruth and Gerald enrolled. When renewal time came, Ruth's renewal went through without any issue. Gerald's triggered an eligibility review. His pension administrator had coded his T4A with a code 2, indicating he had access to dental coverage, because technically, under his pension plan rules, the option was still available to him even though he had opted out. Gerald was confused. He did not feel he had dental insurance. But in the government's definition, having access to a plan, even one you have chosen not to use, means you are considered covered. There is one important exception to this rule. If you permanently opted out of your pension-linked dental plan before December 11th, 2023, and your plan rules do not allow you to re-enroll, that opt-out is recognized. But proving it requires documentation from your pension administrator, confirming the permanent nature of the opt-out. Gerald's situation was borderline, and it took several weeks and several phone calls to resolve. His renewal was delayed, and he had a brief gap in coverage as a result. The lesson from Ruth and Gerald is simple. Do not assume your renewal will be straightforward. Check your tax slip code first. If there is any question about your insurance access history, start that conversation with your pension administrator now, not the week before the deadline. Now, let me quickly cover how the program actually works once you are enrolled, because I know a lot of people are unclear on what it actually pays for and how much they will owe. The amount the CDCP covers depends on your family income based on your 2025 tax return. If your household income is under $70,000, the plan covers 100% of the government's established fee schedule for dental services. That sounds like full coverage, and for many routine services it is. But there is an important nuance. The fee schedule the government uses may be slightly lower than what your dentist actually charges. The difference, called balance billing, is your responsibility even in the full coverage tier. For example, if a cleaning costs your dentist $145 but the government's fee schedule lists it at $134, the CDCP pays $134 and you pay the $11 difference out of pocket. That is a small amount. But for more complex procedures, the gap between the government fee and the dentist's actual charge can be more significant. If your household income is between $70,000 and $80,000, the plan covers 60% of the fee schedule. Between $80,000 and $90,000, it covers 40%. Above $90,000, you are no longer eligible. Before any significant dental work, ask your dentist office to submit what is called a pre-treatment estimate through their billing system. This is free and takes only a few minutes. It tells you exactly what the plan will pay and what your share will be before you sit down in the chair. It is one of the most useful tools in the entire program, and very few patients know to ask for it. There is also some genuinely good news from April 1st of this year. The government made several updates to the dental benefit rules that directly benefit seniors. The biggest one for many older seniors is that certain types of complete dentures no longer require pre-authorization before treatment begins. This was a significant administrative hurdle in the past that sometimes delayed care by weeks. Now, for many denture procedures, your dentist can proceed without waiting for approval. That means faster access to restorative care, especially after extractions. The program has also expanded coverage for denture maintenance services like liners without requiring pre-authorization. Regular maintenance extends the life of dentures and prevents more costly replacements, so this change saves money for both the patient and the program over time. On the other side, desensitization treatments, used for tooth sensitivity, now require pre-authorization due to concerns about overuse. If your dentist recommends this service, they will need to submit documentation showing it is clinically necessary before proceeding. And the fee schedule itself was updated upward in April to better reflect the real cost of dental care, which should reduce the balance billing gap for many services and encourage more dentists to participate in the plan. Speaking of dentists, finding one who accepts the CDCP is still a challenge in some areas. Not every dental office participates, and those that do may have limited availability for new patients. The best starting point is the official provider search tool available through Sun Life, which administers the program on behalf of the government. You can search by postal code and specialty. Large dental networks like 123 Dentist and HelloDent also have lists of their participating locations, often with easier online booking. When you call a dental office, confirm two things before booking. First, that they accept the Canadian Dental Care Plan, and second, that they will bill Sun Life directly on your behalf, meaning you do not have to pay up front and seek reimbursement yourself. The plan is designed for direct billing from the provider to Sun Life. If a clinic asks you to pay the full amount out of pocket and apply for reimbursement, that is not how the program works, and you should look for another provider. Also know that when you book any appointment after July 1st, 2026, ask the clinic to verify your renewed eligibility through the Sun Life portal before your visit. This confirms your coverage is active in their system and prevents any surprise billing at the desk. Let us bring everything together before we close. The Canadian Dental Care Plan renewal deadline is June 1st, 2026. If you miss it, your coverage lapses June 30th, and any dental work done in the gap is entirely your financial responsibility with no reimbursement available. The renewal takes about 10 to 15 minutes through your My Service Canada account online or by calling 1-833-537-4342 with your SIN and CDCP client number ready. Before you renew, check box 01 FEAM on your T4A or box 45 on your T4 to confirm it shows code 1. If it shows anything else, contact your pension administrator or employer immediately to start a correction. Do not wait until after the deadline. The plan covers 100% of the government fee schedule for households earning under $70,000, 60% for incomes between $70,000 and $80,000, and 40% for incomes between $80,000 and $90,000. Always ask your dentist for a pretreatment estimate before major work so you know your share in advance. And if you need to find a participating dentist, use the Sun Life Provider Search tool and confirm that the office will direct bill on your behalf. Your dental health and your financial protection both depend on this renewal happening before June 1st. You have the information, now you just need to act on it. If this video helped you, or if you know someone who is enrolled in the dental plan and may not have heard about this deadline, please share it with them right now. This is genuinely time-sensitive information, and one share could save someone a significant amount of money. And if you are not yet subscribed to Canadian Retirement Benefits, please join us. We are here every single day covering the deadlines, the benefit changes, the tax tips, and the practical retirement guidance that Canadian seniors deserve to have in clear, simple language. Tap subscribe, turn on the bell, and become part of a community that stays informed together. Thank you so much for watching all the way through. Take good care of yourself, and we will see you tomorrow on Canadian Retirement Benefits.